Okay guys, so now let's talk about the typhoid, right? So you must have heard about this very commonly, right, throughout your MBBS days and throughout your in the community level itself. Typhoid fever is very common. In the hospital also typhoid cases are coming very commonly, right? So we'll talk about that. So typhoid fever, basically what is the cause, what is the etiological agent for the typhoid fever? So typhoid is actually caused by Salmonella Typhi, right? So no surprise in that, Salmonella Typhi, right? Salmonella Typhi, if we talk about what is the nature of the Salmonella Typhi, basically this is the gram-negative bacteria, and what I'm going to talk about right now is the Salmonella Typhi, and gram-positive bacteria, gram-negative bacteria. These are the two basic classification of the bacteria, right? Two very broad classification of the bacteria. You must have studied this in the microbiology itself. The thing is, gram-positive bacteria, you must have studied this. Gram-positive bacteria are usually producing the exotoxin. Gram-negative bacteria, they are producing the endotoxin, right? Endotoxins are usually more dangerous than the exotoxin category, right? And this bacteria, which I am saying, this is the gram-negative bacteria, right? Salmonella Typhi, and this means it produces endotoxin or exotoxin? It produces the endotoxin, right? Endotoxin. And in very severe cases, if it is causing the septicemia in the patient, if it is causing the sepsis to the patient, it might cause the septic shock also, right? And that might lead to the multiple organ failure and eventually leading to death. So in very severe cases, that might also happen. So endotoxins are usually more dangerous as compared to the exotoxin, right? By the way, so it is producing what? It is the endotoxin producing bacteria. What is the mode of transmission, guys? If you talk about what is the mode of transmission, so it is getting transmitted, usually transmitted by, again guys, no surprise in that, faeco-oral route, right? It is getting transmitted by faeco-oral route. Look at this particular image over here, right? What I'm trying to show over here, this is under the microscope, okay, you are seeing, okay, what I'm seeing over here is, look at this bacteria, right? This is bacteria and having multiple flagella, right? Multiple flagella is there, okay? Look at this bacteria having multiple flagella. This is the nature of what? Salmonella Typhi. This is the nature of Salmonella Typhi, right? Understood? So it is basically the flagellated bacteria. Okay, what I can write over here, what I shall add over here, it is the flagellated bacteria. Just now I showed you, it is the flagellated bacteria. Okay guys, mode of transmission I told you, it is the faeco-oral route. What are the clinical features? Okay, right, so let's talk about the clinical features of the cholera. Sorry, not the cholera, it's the typhoid fever we are talking about. So as far as clinical features are concerned, right, again guys, no surprise, fever might be there. So fever might be there for about 3 to 4 days. Okay, along with that, usually in the fever, what you are seeing? You are seeing that there is tachycardia, right? Whenever you are having the fever, you will be seeing that, you will be using the pulse oximeter and you will be showing that, okay, saturation is that much, and besides that, you are seeing that what is your heart rate, and it usually showing 115 per minute, 120, oh, it's 125, it is tachycardia, right? Isn't it? But in this typhoid fever, usually we are seeing that it is having the bradycardia, and because usually in the fever we are seeing the tachycardia, but in this particular fever caused by the typhoid, caused by the Salmonella Typhi, we are seeing the bradycardia. So it is not usually happening, it is not commonly happening. So that's why it is called as the paradoxical. So it is the paradoxical bradycardia. Paradoxical means that usually it doesn't happen, but in this case it is seen. So this is the paradoxical, right? So this is the paradoxical bradycardia is seen over here. So that is very important. And these kind of terms might be mentioned in the MCQ and you need to pick those up. Okay, and they might be asking you the diagnosis over there. So paradoxical bradycardia, instead of tachycardia, you are seeing the bradycardia in this patient. Diarrhea is very severe in these cases in sometimes, and this one is the pea soup diarrhea. For example, in the cholera I told you rice water stools will be there, and here in the MCQ they might have mentioned about the pea soup diarrhea that is seen in the typhoid, right? Okay, with that it might be causing the inflammation of the lymph nodes, right? So it will be causing the, it might be causing the lymphadenopathy, right? Then it might be causing the particular rashes, not the rashes, I would say the spots would be seen on the anterior area of the trunk or the chest, anterior chest region you might be talking about. So that is the rose spots kind of lesions might be seen over here, right? So rose spots usually on chest region might be appreciated. Okay, how these kind of lesions are actually looking, into the picture. Okay, we shall talk about that as well. Okay, so look at this particular image, guys. Here what we are seeing, here what I can see, that look at this spot, look at this spot over here, look at this spot, right? Looking like what? Looking like the rose spots, right? So this kind of appearance has been compared with the rose spots over here. So that is called as the rose spots on the chest region, right? Okay, once you understood that, now Salmonella typhi is having 3 types of important antigen, right? So let's talk about the antigen over here. Look at this antigen. Okay, so first of all, again guys, these are what? Flagella, right? So Salmonella typhi is having flagella. Salmonella typhi is covered with the thick capsule over there, covered with the capsule over there, and it is having the chains. What kind of chains? It is having the polysaccharide chains, having the polysaccharide chains. Okay, and it is the membrane of the cytoplasm over here. It is made up of peptidoglycan. Okay, so cell envelope is made up of peptidoglycan. But over here, what I want to show you is that it is having the antigens. It is having the antigens. What antigens I am talking about? Antigens are H antigen, O antigen, and the VI antigen. H antigen is talking about the flagella antigen because it is having the flagella, right? O antigen is the somatic antigen. Soma means body. Soma means body. VI means virulence capacity. Virulence means killing power of any particular disease or killing power of any particular microorganism. This is called as the virulence, basically. So virulence is there, and it is actually present in the capsular polysaccharide antigen, right? It is present in the capsule region, okay? So 3 antigen, guys, again guys, H antigen, O antigen, and the VI antigen. H antigen is telling about the flagella, H antigen is telling about flagella, O antigen is telling about the soma, soma, right? And VI antigen is telling you about the virulence power, right? Killing power of particular antigen, right? So these 3 antigens can be seen over there as far as Salmonella typhi is concerned, which is causing the typhoid fever, right? Okay, guys. Now, if you talk about 2 cases are there, usually sources. What are the sources of this typhoid fever? Again, guys, it could be the cases, clinical cases of the typhoid. They might be spreading the disease in the community, or it might be the carrier. 2 cases can be there, cases and the carrier, right? If I am seeing the cases, usually in the cases, males are, males population is more as compared to the females. So usually carriers are males, right? Cases are males, and if you talk about the carriers, females are more, right? Female population is more as far as carriers is concerned. So over here, what I am saying that if I am talking about the cases, because either it might be spreading from the cases and or the carrier, right? So in the cases, males are more as compared to the females. In the carriers, females are more as compared to the males over here, right? This thing you should keep in mind. What is the reservoir over here? Reservoir would be the same, guys, human only. That's why we are studying this. So reservoir would be the human. Okay. What is the incubation period? If somebody can tell me, incubation period is about 10 to 14 days, right? Incubation period is about 10 to 14 days, right? Usually they are asking us the incubation period. Okay, guys. What about, okay, so we have talked about this one. What about period of communicability? So if you talk about communicable period over here, communicability, okay. So as long as the persons, the patients are having this particular bacteria in their stools, for an example, because it is having the pea soup diarrhea. Remember, it is having which kind of diarrhea? Pea soup diarrhea. So guys, as long as these bacilli are present in this particular Salmonella typhi bacilli are present in the stool of the patient or the urine of the patient, right? Till that point of time, they will be keep on spreading this particular bacteria, okay, and they are actually prominent. They are actually potential carriers or the potential cases of spreading this disease in the community, right? So as long as communicability, if I'm talking about, so as long as bacteria is present, as long as bacilli are present in the stool or urine, bacilli are present in stools or urine, right? So till that point of time, they might be spreading this disease, right? If you talk about the antigen, right, 2 kinds of status can be there. One is the post-infection. The patient is already having the signs and symptoms, right? So after having the disease, which antigen is prominently seen over there? And after getting the vaccination, we'll talk about that. After getting the vaccination, which particular antigen will be prominent in the community, right? So usually they are saying that after the infection, post-infection, okay, post-infection usually, and other case could be after vaccination. post-vaccination status, right? Post-vaccination, right? So usually they are saying that after getting the infection, post-infection, O antigen, right? O antigen is having much role, that is the somatic antigen of the Salmonella typhi, and after the vaccination, H antigen, right? H antigen, that is the flagella antigen, is more prominent, okay, and that has been asked, so that's why I have mentioned it over here. What is the case fatality rate? If you talk about case fatality rate, is not much in this case, but still we need to be very, very cautious over here. So case fatality rate is around 1 to 4%, and usually it is affecting the adolescent and the children age group, that is about 5 to 19 years, right? 5 to 19 years. So basically it is occurring in children and adolescents, right, and for about 5 to 20 years of age approximately, okay. It is following the seasonal trend, guys, right? Remember about the trends, time fluctuation in the descriptive epidemiology, I have explained that, right? So seasonal trend, basically it is in between July to September, right? Basically in the monsoon season, July to September, right? Okay guys, what about how to prevent this disease? Very important question, how to prevent it. Once we have talked about the clinical features and all, how to prevent this particular disease, right? So as far as prevention is concerned, we might be giving the drug over here. That drug is drug of choice in these cases, and that is the fluoroquinolones, right? We should make sure that we are isolating this patient. Till what point of time we should be isolating this particular patient? So please isolate this patient till, because you know, as long as the bacilli are present in the stool, that is a period of communicability, right? So over here also isolate the patient till that point of time when you will be getting the 3 negative cultures from the stool or urine, right? So that is the case over here, right? And you should be actually making sure, because faeco-oral route, you should be carefully following the sanitation measures, right? Sanitation measures. So please do the sanitation measures. Make sure food safety is there, food hygiene is there, water supply is safe over there, excreta disposal should be there, disinfectant roll should be there, right? So all those things which we have talked about earlier, right, we will be following these over here as well. Sanitation measures should be taken care of over here. What kind of disinfectant I am talking about over here? So disinfection must be taken care of. So disinfectant which I am talking about over here, that is the 5% cresol. So 5% cresol, will be using it for about 2 hours, right? And we need to improve the sanitation measures. We have talked about that already. Okay, what will be the ideal management, guys? What will be the ideal management of the typhoid cases? Okay, ideal management for the typhoid cases, or I would say in the ideal management, you know, we are giving that fluoroquinolones, that's the drug of choice. But if the carriers are there, ideal management for the carriers, I will be trying to mention it, the carriers. In the cases of carriers, if they are present over there, then we might be giving the ampicillin in them. Along with the ampicillin, Salmonella typhi might be actually hiding themselves in the gallbladder. So cholecystectomy role is there for the carriers, right? Okay, and if there is multiple drug resistant cases are there, if there is multiple drug resistance, for example fluoroquinolone you are giving, it is not responding at all, right? You might be giving some other drugs, for example cefixime you might be giving in these cases. So azithromycin role has been seen over there. So if the multiple drug resistance cases are coming, azithromycin might be given, or cefixime, that is the cephalosporin, that might be given over here, right? So that is about the multiple drug resistance if you are talking about, right? So in the typhoid, what we have talked about, it is caused by the Salmonella typhi. It is having the flagella, it is having the O antigen, it is having the H antigen, it is having the VI antigen. We have talked about the prevention measures. We need to take care about the sanitation measures over here. The mode of transmission was the faeco-oral route over here, and we have talked about the clinical features, and main clinical features we have talked about over here, that was pea soup diarrhea might be seen over there, along with that nausea, vomiting, diarrhea part, electrolyte imbalance might be seen over there. We need to rehydrate the patient accordingly, and with that we need to take care about the, you know, they might be having the rose spots on the chest region. Okay, that might also be the classical criteria for the diagnostic part over here. Treatment, for the treatment modality, we shall be using the sanitation measures, we shall be using the drug of choice, that is the fluoroquinolone in these cases. If the multiple drug resistance are coming in the community, then you might be trying with the azithromycin or the cefixime over there. Okay, so that was about the typhoid fever. Thank you.